Hi, I'm Dr. Sonia Jessup and I'm talking to you today about vaginismus and treatment with vaginal Botox. Vaginismus is a condition where there's involuntary spasm of the lower third of the vagina, the muscles involved in that area. And it's very common. It affects up to 7% of women, which is quite a large number. And traditionally, this has either been not diagnosed or not treated very well. Something usually sets off the vaginismus, and often this is a pain experience. Traditionally, this has been thought to be a difficult or traumatic sexual experience, but that is not always the case. For women who have very tight hymens, even as a teenager who have tried to insert tampons or like, they may find that an event such as that will set off this involuntary spasm that once occurred doesn't relax particularly well. Other things such as having a baby vaginally, or having vaginal surgery, or going through menopause with the associated dryness can also give rise to this condition in women. So it may be primary, it's virtually always been there, or secondary, where sex has been fine in the past, but something has happened and suddenly it becomes extremely painful to have sex. In the past, women have treated this by seeing a physiotherapist and trying to relax the vaginal muscles. But I know from taking countless women to theatre that these muscle bands are completely tight and rigid even when women are completely anaesthetized and the rest of their muscles are relaxed. So it's not something that can be easily treated just by relaxing or deep breathing methods. This is a problem that often involves something different to treat it. Several years ago, I went to the UK and did a course with the European Society of Aesthetic Gynecology, where they taught me how to do vaginal Botox, which is not readily taught in Australia. What this procedure involves is putting diluted botulism toxin or diluted Botox into the very tight vaginal bands in the vagina. This can either be done in the doctor's room, so in my rooms, using either topical local anesthetic or nitrous oxide or a Penthrox whistle, which gives very good analgesia, if the patient is able to relax enough to allow access to the vagina. In some cases, however, it needs to be done in theatre where the patient is completely anaesthetized and asleep. The outcomes from having vaginal Botox are extremely successful. Over 90% of women find that that extreme pain that they had goes away. When we use Botox in the face, we're using it to relax muscles that aren't spasmed. So women need to keep coming back for repeat Botox injection. When you're using it in the vagina, often one treatment is all that is needed to relax those tight muscles and that spasm doesn't reoccur. Some women need more than one treatment, sometimes two, but I've never had to do 3 treatments on a patient. So it seems to be extremely effective at getting rid of the spasm and allowing people to go forward with their lives. Women come back to me and say it's just amazing. The effect takes course after about 1 to 2 weeks to reach full effect and can last for 4 to 6 months. At this stage, often the problem is gone. If there's still some slight remaining issues, then sometimes a second course of Botox treatment will be recommended. Being able to have a relaxed vaginal opening is really important to being able to enjoy sex, and for younger women even to be able to insert tampons. Some women describe to me that that feeling of constant tension in the vagina just disappears, and even walking around they notice a huge difference. So my take-home message with vaginismus is it needs to be correctly diagnosed. There are other things that can cause pain in the vagina, such as infection or tears. But if we diagnose it correctly and it is these very tight muscles causing the issue, there are treatments available using Botox that make an enormous difference to women. My advice, if you think that there might be a degree of vaginal spasm or vaginismus, is to come in and get an assessment. It is easily diagnosed when you know what you're looking for and easily treated with vaginal Botox. So food for thought. If you're interested, come in and I'll give you some information. Thanks.